Diabetes type 2 is the worst form of diabetes. Diabetes is when glucose levels build up in your bloodstream. Simply not enough insulin to move the sugar into your cells where sugar is used for energy. Type 2 diabetes is possibly hereditary, and it could lead to not so good results. Insulin is a hormone that comes from a gland that's called the pancreas. The pancreas secretes insulin into the bloodstream. Insulin controls the amount of sugar in your bloodstream. Then the sugar is absorbed into the bloodstream, where it enters the cell that helps with insulin. That then takes us to glucose. Glucose is a form of sugar. It comes in two forms that your body produces, that you get either through liver or the food that you eat. Your liver stores and makes glucose. The liver breaks down and stores glycogen into the glucose to help your glucose levels stay within a normal range. What insulin does, it goes into your cells, and your cell health is dependent based on steady supply of fuel from glucose and free fatty acids. With the movement of glucose into the interior of the cell, that can be converted into energy and metabolism that repairs and defense. And what happens over time is when you have high blood sugars, it can cause damage to your cell tissues, such as your brain, your nervous system, your heart, blood vessels, your kidneys, and those are just to name a few. Some of the signs and symptoms of diabetes may be, you may be thirsty, you may have fatigue, weight fluctuation, constant hunger, dehydration in some cases. There are many treatments that are out to treat diabetes. Lowering your carbs. Carb counting is important when you have diabetes. In some cases, you may have to be on oral medication. You may have to take insulin. Diet and exercise helps decrease your numbers when you're dealing with diabetes. Diabetes can eventually lead to kidney damage, glaucoma, neuropathy, as well as damage to your large and small blood vessels. In some cases, you may have amputations, as well as loss of eyesight. Now, there's some things we can do to help prevent diabetes, such as routine care and early screening, keeping your blood glucose as normal as possible, losing weight if you're overweight, and exercise regularly. Increasing the amount of fiber in your diet is important. Mainly, we want to reduce the fat intake, particularly in saturated fat.